Hi, everyone. Welcome. My name is Deborah Almonte, and I'm the program coordinator here at the Jersey City Medical VOCA Trauma Recovery Center. Today, we're going to be discussing our program here and the services we're offering to community members who have been survivors of violent crimes. In the chat, you'll see there'll be some questions that are going to be monitored by the library staff. If you have questions, we'll try our best to address them. Thank you so much for joining us, and I look forward to hearing from everyone. So the trauma recovery model, I'll start off by giving you guys a little bit of history about it. The model itself is to provide a safety net for survivors of violent crimes who are not usually likely to engage in existing mental health or social services for a mix of reasons. In this model, the goal is to offer clinically effective and cost-effective care to people that are primarily underserved, right? So we offer a combination of outreach that's very assertive, which means that we don't give up very easily. We offer clinical case management. So knowing that the victim has been traumatized, we offer supports to ensure that all the other tedious things in their life are not as negatively impacted by the trauma. And then we offer assistance managing all the moving parts of law enforcement if there is a case or some prosecution happening, in terms of accompanying you to appointments, filling out victim statements, and completing applications for victim services supports. The most important aspect of our work is trauma-informed psychotherapy that helps us heal and address the emotional wounds of interpersonal violence. One of the major themes of the model that I feel most resonates with what we're trying to achieve is that we recognize that people are resilient and can overcome challenges that they face if they're given the right combination of services and compassionate support. So one of the things that we know from the San Francisco study is that, where this all began in 2001, is that this model really does remove barriers to care. Often when you're a victim of acute trauma, which means it's an immediate, you recently were hurt or harmed by someone, you can be really in a very anxious and distressed state. And our services are to address those patients so that they can get to the point where they can actually regain some stability. And if they need longer term care, we can transition them to those services after. So who does the Jersey City Medical Trauma Recovery serve? How we are defined, who defines us is the Victims of Crime Act, and that's what VOCA stands for. VOCA is the Victims of Crime Act, and they had a grant program that allowed us to provide services for survivors and their families. A survivor of a range of violent acts, including sexual assault, domestic violence, crimes of violence in the community, like gang violence, other forms of community violence, vehicular assault, and human trafficking. We also included victims of community violence like hate crimes, racism, LGBTQ+ related violence, immigration related violence and trauma. And most importantly, we serve the family members of the survivors and victims, which means that parents, siblings, extended family who witnessed a crime or have been negatively impacted by the incident are also eligible for our services. So I wanted to elaborate more on what is trauma. So according to SAMHSA, which is the Substance Abuse and Mental Health Services Administration of this country, trauma is the result of an event or a series of events or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening. And it has to have a long or a lasting effect or a significant and adverse effect on how you function. That means that since this happened, you have been significantly changed. You're not able to focus at school. You're not able to cope with the day-to-day demands of your day or your work. It's very difficult to feel happy, to get along with people, to feel like you can navigate your commute to work or your commute to school. So trauma's impact on the body is well documented. And here's a really good image on usually what a child or an individual that has been impacted by trauma body may look like. So what we know about childhood trauma, when it's a child that has been impacted by trauma, is that it occurs when the child experiences an actual threat or negative event or a series of events as well, or the circumstances that cause emotional pain and overwhelm the child's ability to cope. And that can be very varied, especially because there are so many incidents in our communities that can cause some trauma, including things like displacement because of a fire, because of an incident like a gang violence or domestic violence. There's a lot of issues that really influence our children. So young children who experience trauma may have difficulties forming connections or attachment to caregivers and teachers. They may have a lot of difficulty feeling safe or connected to other people. They may experience difficulty sleeping, definitely a lot of difficulty concentrating at school when they're anxious or can't stop thinking of the incidents that occurred. They may become anxious and depressed if they're older and have the capacity to really process what's occurred. And sometimes if the feelings are very overwhelming, they may become self-destructive and try to escape their feelings by numbing themselves using drugs or alcohols or other a varied range of activities to ameliorate those symptoms. So what we know about trauma is that it changes the brain. And in this image, you can see very clearly the major aspects that are significantly impaired by trauma are the thinking center, right at the front of your forehead. That part is called the prefrontal cortex, and it becomes significantly underactive. This is what your brain on trauma is like. And at the bottom, that little space dot there, which is a circle, is the amygdala. And that one becomes very active. And that's where fear resides, which is why we always say trauma and anxiety are very interlaced. Your memory center, your hippocampus, can be very underactive. And then the dysregulated parts is the interoceptive center. It's your ability to kind of know how you're feeling, right? It becomes very hit or miss. And we know that the underactive parts are the self-regulation center. And that's where it's so hard to calm down, to sit down when you're a child, to feel calm, to feel like you're safe, and sometimes to even know what's going on with you when you can't sit down. Another image I like to elaborate on what the brain goes through when it's in trauma is some of the phrases in this slide. So, sometimes I can't handle the simplest task. And that's what's happening with the thinking part, right? Or sometimes I feel depressed, or most of the time I feel depressed. I can't concentrate. I can't sleep. I feel spacey. I can't think straight. I feel like I always have to be vigilant, ready to take another attack. In this image, I think offers some more clarity about the brain and the body. Here we have child trauma, and we know that child trauma is overwhelmingly distressing and painful for children, especially when they're really young. And what we know about the research is that they're twice as likely to develop depression and 3 times more likely to develop anxiety disorders as an adult. The common causes of trauma that are known in these research studies are child abuse, witnessing or being victimized by violence, which is what we address in our program, war or terrorism, and being separated by your loved ones or bullied at school. We know that the long-term aspects of trauma, it really does affect your perception of your reality. It really does take away your sense of safety, creates a sense of helplessness, and it definitely augments how sensitive your trigger is for fight, flight, and freeze response. We know that the initial trauma of a young child can go underground for a little bit, but it will come back to haunt you, especially as your brain starts to develop. What we want to treat is that we know that the amygdala becomes very overwhelmed, and the brain is now what's called bottom heavy. And as you come into treatment, what we want to do is really create a more balanced brain activity. And you'll see more about that as I continue this presentation. What we know about trauma, we've been learning a lot more because of the Adverse Child Experiences study called the ACEs. The ACEs has had a humongous impact on the work that community organizations and schools are doing, because we know how much of these experiences impact the future violence, victimization, perpetration, and lifelong health and opportunities of children throughout their lifespan. And as you can see in this image, this is the ACEs on your right. And we know that adverse childhood experiences cause social, emotional, cognitive impairment. We have the adoption of risk behaviors, diseases, disability, social problems, and unfortunately, an early death. What I really like about this slide is that we add to it the social conditions, right? Beyond the incidence of trauma, being in an environment where there's a lot of violence and a lot of isolative situations, just like this pandemic, also increases the impact of trauma on your life and opportunities. We also have the aspect of generational trauma, historic trauma, like African Americans that experience slavery, and other communities that have been oppressed or immigrated from war zones, like refugees. So the ACEs, now in this study, we've learned that the associated harms from adverse childhood experiences are preventable. And our program is one of the 6 interventions recommended as evidence-based trauma-informed interventions. So here's what we know based on this study. Treatment to lessen the ACEs can really address depression, fear, anxiety, PTSD, which is post-traumatic stress disorder, and address the problems adjusting to school, work, or daily life, and other symptoms of distress. Treatment to prevent problem behavior and future involvement in violence is what this program is for. Evidence-based treatments that we provide by trained clinicians in the home and clinical settings help alleviate the stress in the family and give families and individuals this coping skills and the resources they need to really recover. At the Jersey City Medical TRC, what we have is an interdisciplinary team And what we do is lessen the immediate and long-term harm by providing these services. We focus on providing trauma-informed, evidence-based psychotherapy. Approved practices include motivational interviewing, seeking safety, cognitive behavioral therapy, EMDR, dialectical behavioral therapy, and cognitive processing. I'll be talking a little bit more about treatments in our next slide. So when we're talking about treatment, what we're talking about as evidence-based treatments are brain-based approaches. And what that means is that we're really going to be alleviating or addressing the challenges with the underactivity in the prefrontal cortex, the dysregulation in the brain. And as you can see, we help clients think differently. And then the bottom-up approaches are EMDR, yoga, sensory motor psychotherapy. And that is, we help clients cope with emotions and improve the defense reactions. And you can see in this image how trauma really does fragment those parts of the brain and change how they function and the rate that they're able to communicate effectively. And treatment is here really to repair it and to offer you an opportunity to heal. At the Jersey City Medical TRC, our team of clinicians also provide clinical case management. Among other things, we accompany you to court proceedings if there's a legal aspect to your case, medical appointments, filing applications for the Victims of Crime Compensation Board, any police reporting, assistance with obtaining safe housing, any financial entitlements that you're entitled to. And we also try to keep you linked or relink you to medical care and other community-based organizations. So now I want to talk a little bit about the flow of treatment. So usually patients or individuals are referred to us or come to us from all the work I've been doing in the community to inform you, including coming here to the library. So usually through outreach or referrals, whether it's self-referred or someone heard about us. And these are some of the agencies we've been able to collaborate with. Once a patient is connected with us, one of the first things we do is screen them for eligibility. We want to ensure that the patient meets criteria for the type of patient that we are granted to provide services for. And we want to make sure that if they are eligible, that they get their services pretty quickly. So once the patient is eligible and ready to engage at this level of care, they receive a combination of the following services to meet their individual needs. Often if it's a recent crime, we really work hard to help them with crisis stabilization. And that may be a mix of things. So if the crime is recent, they need relocation assistance, they need to connect with an attorney, they need to connect with a housing office to transition, to move to a different location, to speak to the investigating team if there's a crime that was committed, or attend any of the hearings that are now virtual, we can accompany them to that. At that point, we're also engaging the patients in assertive outreach, which means that we will try to accommodate them. Obviously, with the pandemic, a lot of the children are home, doing virtual school, and it doesn't make it easy for parents to come into our offices. So we do our best to use assertive outreach to make accommodations, whether it's a virtual meeting or an in-home, or if it's really early in the morning or later in the afternoon. Clinical case management is used initially in treatment to make sure that we can collaborate with all the people that were already involved with the patient. So usually that means that if they were employed at the time or a student at the time, and they need some assistance really contacting these employees or teachers or institutions without really violating their own privacy, we try to collaborate with them to give them documentation they need to take the rest they need and to focus on their treatment. If they're ready, then they engage in individual or group evidence-based trauma-focused psychotherapy. And I like to emphasize that because this is very different from regular counseling, where it may take a little bit of time to address the trauma, because we are focused on treating patients that have a recent crime or victimization within the last 5 years. We are really focused on helping patients address the index crime or the source of the trauma. If they have a need for a medication evaluation or medication management, if they've already been seeing a psychiatrist in the community, we try to support that and assist them in re-engaging with that service. And if they need legal advocacy, we also have connections to legal services in the community and provide referrals as indicated. So a patient is entitled to around 16 sessions when they enroll with us. And if they need more, they can, we can discuss it as a team to discuss the need for continuity or the need for a transition. But usually if a patient completes their goals, which is to be stable and free of anxiety or distressing symptoms, let's say, that were interfering with their ability to return to work, and after 5, 6, 7, 8 sessions, they feel ready to return to work, we provide them with all the documentation they need to return to work, and they are now just attending treatments to expand their coping skills and continue to sustain the gains that they had in treatment. And they transition now to termination in the last 5 or 6 sessions of treatment. During that period, they're able to process their termination and discuss the flow, what's next on their flow. And usually if a referral, if it's indicated, the survivor can benefit to transition into a different program. And in the last 4 months since we began our program, survivors have been very interested in vocational services, in taking ESL classes to learn English, in going back to college, in figuring out expanding their career goals, maybe doing some advocacy work against anti-violence services. And a few of them have returned to their community-based mental health providers that they probably saw for different courses of treatment when they were younger. So usually that's what we've been seeing as a trend recently. But if a patient is no longer in need of services and just wants to terminate, they can do so easily. And they know that if the symptoms re-emerge or they have challenges in the future, they can always re-enroll. So I just wanted to clarify a little bit more about eligibility. So what if you are a victim of a crime who has sustained a personal injury, mental trauma, or unfortunately a death? Or you are a surviving spouse, parent, guardian, child, or other relative or dependent of the victim of a crime who has died or been severely injured, then you are definitely eligible for services. If you are already seeing a mental health counselor or therapist in the community, or you've been in treatment with this person for about 5, 6 years, and even if you've experienced a crime, or you have a trauma that's not related to the crime, What if the crime occurred when you were 5 and you are 20? What if you're the batterer or offender? What if you currently live outside of Hudson County, like in New York? Then unfortunately, you are not eligible for psychotherapy services at the TRC, but we do our best to assist you. So you'll be referred to a provider, given some lists, and you can always follow up with us for information if you have questions, if you have concerns, if maybe you want assistance talking to your therapist about the services that you might want to incorporate into your treatment, or you want some support outside of your treatment, like a trauma-related support group for DV, for a victim, for grief, then we can assist you in connecting to services like that in the community. So here's some information about the flow in one screenshot. To refer an individual or a family to the Jersey City Medical TRC, or if you just have questions or would like to consult about somebody possibly being eligible, you can always call our offices or email me, Deborah Almonte, at deborah.almonte@rwjbh.org. We are located physically at the 1825 John F. Kennedy Boulevard building in Greenville, and this is in Jersey City. I just wanted to add that I did add a bibliography to this just because I'm presenting to the library. And if you guys want more information about the trauma recovery centers that are now a national program, you can go to the traumarecoverycenter.org. And if you want more information about the ACEs, the Adverse Childhood Experiences Study, you can go to the CDC. Most of the pictures and the slides that you saw in the slides, you can find there. Thank you so much for your time. I appreciate this so much. And if you have questions, I'm more than happy to answer them.
Thank you so much, Deborah. Thank you everyone for joining us. I am going to stop the recording and streaming now so that we can go to the Q&A. So if anybody watching this at a later date or live has any questions, please reach out to Deborah.